So this is one of my favorite stretches when it comes to opening up the hips because it's really scalable and useful for everybody. However, there's a few points that I want to discuss in here that can really help optimize this stretch, and some points that we're truly focusing on that sometimes are missed. So one, we like to call this the hip opener, and the reason is because it opens the hip. That means if you find yourself like this, you're not really opening your hip, and it's also not very comfortable. And when we're in this position, what you're gonna notice is the knee, my right knee, is gonna naturally want to open up. Now, I'm gonna get to the importance of that with the squat here in a second, but something that is not good when our knee opens up, when our knee goes out, when our hip opens up, I should say, is a lot of times people want to then bend at the ankle. We need to make sure that the foot stays flat, number one, and also not like externally rotating out, because that is a telltale sign of a tight Achilles. So we want to keep the foot straight. We want to allow the knee to naturally go out. We don't need to shove it out, because then that's also not anatomically correct, for lack of better terms. And so from here, what I want to do is I want to find a comfortable position with the foot straight and also flat on the ground and with my knee open, because what this is going to do is this is going to turn this into something I like to call a positional stretch. And what that means is it's going to stretch the weakest link first, so to speak. So often we say, not the weakest link. It's going to be the tightest link. Sorry. So we always jokingly say it's the weakest link. Well, in this case, because I don't believe it deals with a weakness, we're going after the tightest area first. And what I mean by that is 10 people can do this stretch, right? And if someone has the tight area in their butt, then that's where they're going to feel it. If somebody has it in their left hip, which you're going to see in a second when I switch my legs, that is where they're going to feel it. Many of us might actually have a tight lower leg complex, the Achilles and things like this, which is going to then force the foot to want to pick up, especially if we've sprained our ankle like laterally, like most people usually do. Then we're going to notice we're lacking the range of motion to honestly hold a clean position here. So what we can do once we are in this position is we can start to rock back and forth. Now, this is important to note because we've learned that like ballistic stretching and rotating while you're stretching. Sorry, I got a little bit worried my mic wasn't on there for a second. So the ballistic stretching is when we used to bounce, right? We were told that that was not good and that didn't allow our nervous system to effectively open up and blah, 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 blah. Well, technically for the muscle, that's true. But we also have fascia and capsules and things that wrap our bones into our joints. And these things actually, I would say, stretch better with a little bit more motion because it's opening them up. It's almost like a mobilization that your physio or chiropractor might do. So by rocking back and forth naturally, you will feel the difference yourself that the hip starts to open up. Now, before I go into how we can then go further or deeper into the stretch, I want to talk about the squat issue that I spoke about in the beginning, where I said about the hip opening up and the knee coming out a little bit and the foot making sure it stays flat on the ground. Well, a lot of times when I'm lecturing and there's more than 10 or 15 people, I want to look at their squat and I want to teach them the importance of external rotation, why they are squatting. The problem is I don't want 20, 30, 40, 100, 200 people having terrible squats while I'm trying to fix every single one of them. So often what I do is I put them in this position and I make them realize that this is basically, or it is, a half position of the squat. And what I mean by that is when people come down, if they're in this position, then I know what their squat is going to look like. When they squat down, it's going to look like this. If they are dropping in this hip opener position like this, meaning their knee is collapsing in, what do you think it's going to look like? And so a lot of times what I see is people completely straight up with their knee and they're not allowing this open position within their hip. So they're almost kind of like jammed up in this area, and then when I open their hip, you see them naturally relax and fall into this position very easily. Again, that's because the body is very sophisticated, but we have to learn how to work with it. Now, many people think, okay, cool, it's time to drop in the next position, and they drop all the way down. Well, mobility, ironically enough, is not my specialty, or flexibility, range of motion, which is good because I had the tendinitises, I have scoliosis, I had all of these things, and I'm a perfect example of how you don't need to have perfect mobility and flexibility in order to be pain-free. So what I like to do in this position is instead of dropping down right away, I like to walk my hands out, because what that does is it changes the body weight in the center of gravity and your pull towards the ground. And this will naturally allow the stretch to become greater. As you walk your hands out, you will feel exactly what I am talking about. And then from this position, we can again start to rock back and forth. We can just make sure we're breathing from our diaphragm. We can try to drop one elbow down if we want. We can try to drop the other. We want to make sure that we don't turn out of the stretch as we do it. And I think most importantly, even though I've said this like 10 times, because really everything is quite important, is we want to, when we come out of the stretch, because we've been holding it for quite some time, and depending on your tightest link, that's where you're probably going to feel it the most. Mine actually today is my left hip. That might have been from the run this morning and the massive amount of salsa dancing I did this weekend. But then we want to go to the other side, and we want to allow the same thing. We want to allow the hip to open up here, the knee to open up here, the also left hip, the ankle on the ground, foot straight. We want to start rocking, opening the position. And the most important thing is what we're looking at here is the balance. Because if we don't have a good balance between the two, this is kind of like a tug of war of the body with Team Navy SEALs versus Team Toddlers. It's not good. Our body doesn't understand it. And often the pain that we are feeling is actually coming from exactly that, an imbalance. So if we can learn how to get this balance back really within everything, so internal rotation of your left should be like the right, really everything should be in balance, we will start to realize that the mornings getting out of bed pain-free become easier, and everything really just becomes smoother because our body understands what it needs to do in order to fix itself. We just have to get out of our own way and allow that to happen. All right, so if you guys enjoyed this video, please check out my TikTok page at Unbreakable Body, my Instagram at RehabGTS, and most importantly, I guess, my free 5-day Unbreakable Body Challenge, which you can see the links down below. And obviously subscribe, share the videos with your friends. And if you want to see my videos Monday, Wednesday, and Friday, when they do come out, hit that notification button. And like I said, in the G-Spot podcast, if you want, website should be, everything should be linked below. And like I said last time, if you want to check out the shorter videos to TikTok and Instagram, see me there because I'm going live. I'm making videos 1 to 2 times a week, 1 to 2 times a day there. I can't talk. I'm just going to end it right now. Happy Monday. Hope yours is going better than mine. Ciao.